this is a bonus module for you that will further support you to save time in research and overall project. In this bonus lesson, I'm going to show you how I integrate artificial intelligence in my everyday work, in fact, in every hour work, to save time but still get reliable data in research. I have been using AI tools like ChatGPT, Perplexity, Copilot since their arrival in the market, and I use them every day. And my latest addition to my artificial intelligence and machine learning tool is MediSearch. You are probably already familiar with ChatGPT kind of tool, and you have probably heard also the controversies. Maybe you are holding yourself back because of the plagiarism issue, the confidentiality issue, and all those time that would take you to cross-check the data, the reference. And one of the reasons behind this problem is that ChatGPT, Copilot, Perplexity, all of them, they are created for everyone, not particularly for medical science professionals. That's why I'm going to introduce you today and show you a demo of MediSearch so that you can also do the comparison yourself and do a research a little bit if you want to incorporate this tool to save time in your project and get more reliable data. Here we have the interface for MediSearch, and you can see that it's direct science-based answers to medical questions. Why are they saying direct science-based answers to medical questions? That's where actually it is, I would say, better for medical writers compared to other ChatGPT-based algorithms. So you can see, you can actually ask MediSearch to where to fetch the data from, not all over everywhere internet, where you also have lots of misinformation. You can choose the publication date. So let's do in the last 10 years. And then you can ask if you want to include scientific articles, books, and international health guidelines, which is very important for a lot of disease diagnoses and disease management. And then you have Healthline. It's a good source of information, and read it and decide for yourself if you want to include Healthline or not for your project. As you can see, I am in Pro now, but I'm not subscribed. I think it allows you for some professional free search every day, but I will show you how it looks like both when you have the subscription with Pro or you are using it a few prompt every day with the Pro, or how it looks like with the free version. All in with consistency to what we have done so far, let's ask what are the investigational drugs for type 1 diabetes? We have the filter where we are asking to search for. Actually, let's just look scientific articles. Okay, done. I have been actually impressed with how it presents the data with citations very specifically. So it's saying that teplizumab, you have it in citation 1 and 2. And if you look at citation 1, you can see that it's a review article. Just click here. Yes. So you have a lot of information from what time and what is the quantitative data. This gives you immediately good information of what's in this article that would be relevant to you. And if you want, you can actually go to the full text from here. Okay. Let's see how it would look like if I didn't have the Pro prompt. Just copy it, paste it, take off the Pro, and do the search. So as you can see, with the free version, you still get some information, but not as comprehensive as you get with the professional one. And I would say that for day-to-day search, if you don't need a lot of information, you are just trying to get started with something that would give you an idea, okay, this is the one I'm going to work on for the next 10, 20 minutes. This is already a good free source. To present you with some other features, you will see that the language, wow, they have a good selection of language. Especially if you are in North America, you are bilingual with English and Spanish or English and Fosse, you can use this language too. I can see Hindi and some other widely spoken languages. I wanted to show you some study. I wouldn't be convinced on using some tools that I haven't researched myself. And that's where I found this study. It's really new. The printed version has not been published. And I was looking at the results where I don't have access to the full version, but I can see that in the results section, they showed that for reliability and global quality scale assessment criteria, MediSearch showed the highest values. So that was good. And then I checked who are the founders. And from a quick Google search, I found that it's Edward and Michael. And looking at their experience, so Edward has a PhD in machine learning. So he has a research background and worked with Amazon. And I think his co-founder, Michael, also have a very rich background working with Google and a master of philosophy from Cambridge. So overall, I felt like I could rely on this tool to do my everyday search where I need the citation, where I need to trust my data. If you have more questions, I will have the link with this lesson and you can go and you'll see what they are saying about the tool. If you are interested, why don't you check out the tool and do a quick search and see if you are satisfied with the results, if the result help you move forward the project.